Hi everyone. This is the first time I've gone live for a while, so I'm just going to sort of sit and chat for a little bit, see if anybody comes in to say hi. As you saw from the introduction post that I put with this, I thought it was time I actually came and said hello to you all again, reintroduced myself a little bit. Since I've moved into the new clinic, I've got loads of new followers. I haven't done a post like this for a while, so I thought it was time to come and say hello, tell you a little bit about what I do, the changes that have happened since I moved into the new clinic, and just so you to update you a bit, and like I said, tell you who I am and a little bit about what we do here. So those of you who do know me, obviously you'll know that I'm Sally Wagstaff, and I have had my business for the best part of 10 years now, which is crazy really. One of the main thing that I started with all those years ago and still do today is the laser hair removal. In fact, that's what you can see behind me here. So we use soprano ice laser hair removal, which is honestly genuinely pain-free. And if you want to, if you don't believe me and you want to come and have a go, just give me a shout and I'll get you into to have a look. But over the years, obviously, we've introduced a lot more things. As a registered nurse, I figured there was so much more I could be doing in the clinic, and so that I do a whole wide range of skin treatments. So that starts off with sort of topical home care type products. So I've got quite a deep knowledge now of the types of ingredients and products we should be using on our skin day to day, and for sort of specialist treatments and problem skin. So I can put together a really basic routine for you day to day, or we can do something a bit more specific for problems like acne and rosacea, irritated skin, inflamed skin, and then sort of the sort of deeper anti-aging and things like that. And alongside those products is the treatments that add that extra layer to it. I talk in layers a lot, so you start all of the skin treatments and stuff that I do from the sort of the gut, and then the sort of highest level would be surgery, which obviously I don't go anywhere near, but there's all the different layers in between, and it starts with home care products. It's really, really important. The skin treatments that I offer include microneedling. I'll sort of show you some of the bits of kit that are around the clinic in a minute. Microneedling, chemical peels. We've got plasma now for baggy eyes, hooded eyelids, wrinkly skin around the eyes. That's also for removing things like skin tags, and also for, so mainly for eyes. Sorry, lost my train of thought there. And then the other treatments, we've got Geneo, which is skin tightening, oxygenation, exfoliation. It's a really lovely facial to have. And we can do combinations of all of those and include things like LED, and really sort of get the most bespoke treatment for you and your skin. And then the next layer up from that, talking in layers again, is the skin boosters and skin conditioning injectables. So it is a layer of injectables, but it's not as dramatic, if you like, as the sort of fillers and Botox, which we come to after that. So the boosters level is Profilo, which is a skin remodeling agent. It's a collagen booster. It gets into the skin. It helps with lifting and tightening, hydrating, general anti-aging, skin plumping. And the even more superficial boosters that work on skin condition and can really, really make a difference, can help with things like rosacea and stuff like that as well. Skin boosters are great, and they go with all those other things really well. And they're a really good option for people who want something a bit more, but perhaps don't feel ready yet for things like fillers. And obviously then the next layer then, the next type of treatment would be the more clinical grade injectables. Fillers are great. People are scared of fillers, and there's so much out there in the media that shows them to be these really awful things that make people look unnatural and terrible, and they're really not. The things you can do with fillers are very subtle, very rejuvenating, and no one should know that you have fillers. It's, I don't want people to go out with big duck face and chubby chipmunk cheeks, and I don't want them to look odd. I want them to look age appropriate, but I want them to look amazing for their age. As we age, we lose volume and structure in our faces, in our cheeks. We get the saggy jowls, and we get hollows under the eyes. We get deep nasolabial folds. We get sort of the creases in the corners here. And fillers can do so much without anybody knowing that you've had anything done at all. And I think the people who, they come to me for a while and they say they don't want fillers, and as they get to know me, we do skin treatments and we make their skin look really great. The treatments are really important for slowing down aging, for keeping the skin functioning really, really well. And then the more they see me, the more they learn about how fillers can be used without having to have them yet. And we get to a point where they understand what it is I try to achieve with fillers. And they then go on to have them and realise what it is I've been saying about them. So there's more often than not, I start very small with a little bit of rejuvenation. More often than not, the mid-face is a place to start. This is the place where we lose volume. It becomes quite apparent because it affects the lower and the mid part of the face around the eyes. So fillers can really help with anti-aging without anybody knowing that you've had anything done. The other obvious one, the one that everybody's heard of, is Botox. Botox is not the same as fillers. A lot of people don't really understand the difference between the two. Fillers is an actual substance that you put under the skin to create shape, definition, replace volume, and all those kind of things. And Botox, or botulinum toxin, is actually an ingredient that stops the brain being able to talk to the muscle. So where you've got, mine's actually due. So if you can see my forehead, what I don't have these days is the static lines, the lines that are visible when you're sitting still. And that's what we start to develop as we age. So the right skincare, the right treatments, and regular treatments like Botox can really help get rid of those. I had very deep static lines for a while. So if I raise my eyebrows, you can see some lines because mine's due to be done. And if I frown, you can see these 11s here. A lot of people have these very, very deep 11s here, and it can be quite stressful. So what happens is you put Botox, it's a very tiny amount of product into those, and that product stops the brain being able to talk to these muscles. You've got muscles here called the frontalis, you've got the glabella, corrugators. This is just the anatomy that I need to know where to put that to get the most appropriate result. And you put these tiny amounts of this in there, and after 4 or 5 days, that product is completely out of your system. But the effect remains for up to, well, in some people, 4 or 5 months. Some people are lucky and get longer, but generally we say sort of you repeat that every 3 to 4 months. It's a great preventative. It is the magic wand, but you must be looking after your skin as well. So I love doing that treatment because it's quite a quick treatment. There's no real downtime. You might have some little red marks across your forehead for an hour or two, and it is possible to get small amounts of bruising, but generally speaking, there's no real downtime. The effects kick in within about 4 or 5 days, up to 2 weeks. Some people quicker, some people longer, and everybody gets a review with me to see if it needs an adjustment. And generally speaking, that adjustment would be included in what you pay as well. So it is the magic wand. It is the quick fix. It's difficult because we're not allowed to advertise that, so obviously I haven't told you any of that. But it is something that people end up doing. It's the bread and butter. It's the one that they come in regularly for, and we fit the treatments and fillers and things around that. Profilo is becoming one of those as well, the one that people just book in regularly because the long-term effects are so good, and the rejuvenation and the anti-aging you get from something like Profilo is really, really good. So these things sort of become a regular thing so nobody will know over time that you've had these things done, but it is really good for long-term skin sort of aging and things like that. So that's the bulk of what I do. However, the things that have changed recently, obviously the plasma was a very new introduction recently, and actually it's proving really popular, particularly for skin tag removal. I've done so many skin tags, it's great. And that can be something that could be quite upsetting for people, particularly if they're on their faces. The places I tend to see them most is on the face. I've done a huge one on someone's scalp recently, which was good fun. So faces, underarms, and around the neck seems to be very common. So these are all treatments that we can do very simply, reasonably comfortably. I always use numbing cream. I can do injectable lignocaine as well if they're particularly big, or if you know you're going to struggle from a comfort point of view. So that is something we can look at for you. But something I'm really excited about, and while it feels like a little bit of a departure from what I do, it's an itch I've wanted to scratch for a while. And I am introducing, as of this week, body piercing. Now, to me, it's a clinical treatment. It's a clinical procedure. You are putting large sterile needles into the skin, which is something I'm doing on a day-to-day basis. Without naming names, there are particular establishments that regularly do ear piercing, particularly sort of external cartilage and lobes. Very, very, thousands and thousands of them. And most of the time, they're absolutely fine. A lot of people don't want to go to places like that. The other type of place you can go is tattoo places, and I don't have a problem with that. I had my own tragus done 2 weeks ago in a tattoo shop. I'm very comfortable there. It doesn't I don't have a problem with it. But I wanted to offer something a bit different, and that is the clinical element. You have a private, discreet room. It's a clinical space all of the time. And some people prefer that. They don't want to sit in a room with other people, perhaps. And it's just something I'm really interested in doing. To me, it is an extension of what I'm already doing. And I'm really excited about introducing it. My first one, I think, is booked in on Tuesday of next week. And that's only because I haven't got any other spaces available. It would be available from Friday, but I haven't got any spaces till Tuesday. So if you want anything like that doing, so I will be doing all of the ears. So things like your helix, tragus, lobes, obviously, and all the ones in here. So your daith, your rook, forward tragus, those kind of things, reverse tragus. And also everything from the belly button upwards. So that's belly button and nipple as well. We'll be doing noses. And so the only thing I have said I'm not doing is anything below the belly button. You can keep that. You can find somewhere else to do that for now. And I'm also not doing tongue piercing. There's various reasons for that. The safety elements for me aren't, I'm not entirely happy with doing that area yet. It might be something I introduce later, but the blood vessels in the tongue, the pain levels, the risk of infection, and the long-term ongoing effect on the teeth as well, the enamel of the teeth, is an area I'm not entirely comfortable with piercing at the moment. So that might come in time, but at the minute it's belly button and upwards, not including tongue piercing. So I'm really excited about doing that. I can make it nice and clinical. It's very discreet, very quiet. There's no other shoppers around you. And I'm really excited to be able to offer that. And I said I'm not knocking other places that do it, particularly tattoo places. They are very, very experienced piercers. And for the most part, I think the places you go to are doing it properly, and they're very used to doing it. I just want to do it because I want to do it, and I'm interested in the process and the outcomes. And I'm here in a slightly different environment, so everybody wants something different, and I'm here to offer that slightly more clinical, slightly different environment, quieter environment perhaps for some people who are nervous about having it done. So that's something that's coming really soon. If anybody wants that, I'm going to start putting links out for booking. In fact, I have done some already. There is a direct booking link. You can book piercing online as well as any of the other treatments I do. If you're a new client, you have to book a new client appointment first, except for piercing. So for piercing, you can just book your area that you want treating. If you're not sure, just book ear piercing and we'll go from there. It's not a problem. But for any of the aesthetic treatments, you can go online. The link is in my website. I've got Linktree at the top of Facebook, top of Instagram. And you can book any of those treatments. I said new clients need to book an initial consultation. If they've never been here before for any treatments, whether that's laser hair removal, aesthetics, anything except piercing, you must have a consultation first. Piercing, you can just book the area that you want. If you're an existing client, you can go in and book any of your normal treatments. If you're not 100% sure what you want or you need, there is a I don't know what I want yet, or I don't know what I need yet option. You can book that, or you can book the closest thing you can find. Generally speaking, we can still fit that in because it will book it. As long as you go roughly, what you think you need, whether it's bikini laser or Botox 3 areas, even if you only want 2 and you can't find the 2 areas, we can make that work. And if you're not sure, book it and then ping me a message that you're not sure if you've got the right thing, and we'll sort that out for you. So I just wanted to come and talk to you a little bit about what I do, who I am. The thing, I don't know if I said at the beginning, I am a registered nurse. I've been frighteningly nursing for 30 years this month. This month is my 30-year anniversary of joining the Royal Navy to do nursing and training with them. So I don't quite know where that's gone, but it has apparently. And here I am, still doing it. Amazing. So I've been nursing for a long time. So all of the treatments that I do, I have, the background experience of that nursing, of infection control, complication management, and those kind of things that fit in with all of the treatments that I offer. In case something doesn't go according to plan, I do have the skills and the background and the training to cover all of those things. I'm always updating my skills and training. I very rarely go more than a couple of months without doing some sort of training course, because I think it's really important. Things change. I want to keep my skills up as much as I possibly can. And so what I can show you is some of my certificates. So in the reception area is all of my other certificates. These are all my injecting ones. In fact, it's not all of them. That's most of them. There's 6 there. There's one on the side that I still have to put up, and there's some that I haven't actually got in frames yet. I've only been in this clinic for about 6 weeks, so I haven't quite finished everything yet. But just to show, you know, I use reputable companies. I get a lot of support and training from companies because they know me now. And so that's really, really important to me. So while I've got you, before I finish, I will just show you around the clinic room. I'll do the reception area another day. So this is my laser hair removal station. This is all the things I need for laser hair removal, the goggles, the gel, and all the things that I would use for that. And underneath this is the Geneo. Whoop, going off here, the Geneo. That there lives there to keep safe. That's your skin tightening bit of kit. It's fabulous. I showed you the Soprano already. That's the Soprano ice. And as I turn around here, so over here is the sink, clinical fridge, sharps, and then in those cupboards up there is all the fillers. So all the fillers that I use. Let's go have a look. So I'll stand here. Oh, no, we're not going to go that way. Yeah, no, I was right the first time, wasn't I? Confusing myself. So in there, we've got, wrong way. It's back to front, I can't do it. Skin boosters, Profilo, Kai Sense are one of the brands of fillers that I use. These are all for, all the different colours are different sort of strengths, if you like, of filler. And then in this cupboard, we've got some skin booster, topical treatment, lip fillers, skin fillers, dermal fillers, for that the one I mainly use for cheeks. These two here, this one is your tear trough filler. Teoxane's a great brand for tear troughs. It's one of the only ones licensed for tear troughs, so I use this one. And then the Redensity one is also a skin booster. So there's a variety of brands, variety of products that I use. All of my sterilising equipment, there's one there. I've got a proper autoclave as well, so that's really important. I can show you my view, which is amazing. Those of you that know Lichfield, if I can get this a bit bright today, can I get that? There you go. There you go, that's Lichfield Cathedral. Lots of scaffolding up there at the minute. But this is my fabulous view out of the window. And if you can see there, we've got all the chimney tops as well. This is, for those of you who have been with me for a while, will know how different this is to anything I've had before. And here's all my other bits of kit and equipment. Skin pen, this is microneedling. This is a really fabulous bit of kit. Skin pen is microneedling for all sorts of different skin conditions, general anti-aging and more. And then more recently, we've got the plasma, which is fabulous. More Profilo. Lumia products, so this is all for skin treatments, chemical peels and that kind of thing, and some of my literature and what's it and art there. That's all my laser handsets. There you go. This is the Saluma. Oh, and I haven't switched this on today. This is my flashing head. Oh, there you go. Quite like him, he's pretty cool. So that's a little walk around my new clinic for those of you that haven't seen it before. So I thought it was about time I reintroduced myself and said hi. Any questions about anything that I've talked about or any of the treatments that I offer, jump into the website or the Facebook page. And if you're watching this because I'm going to save this video and I'm going to put it on my new page, which is Lichfield Piercing, because I thought I'd put it on both those to introduce myself. Then if you're following me on Lichfield Piercing and not Sally Wagstaff Aesthetics, do come across and follow me on the other one, and vice versa. So if you're already following me on the one that I'm doing this live on Sally Wagstaff Aesthetics, but not Lichfield Piercing, I'd be really grateful for a follow and some support across there as well. But any questions, come and give me a shout, come and book some treatments, and I hope to see you in clinic very soon. Have a lovely day, nice to see you, and I'll catch up again soon. Bye.